Hi, this is Lacey. I'll be doing my dressing change skills checkoff. I would start out by gathering my supplies, checking the provider order, checking for any allergies or anything like that. So I would I'd have my patient, I would gather a blue chucks, some regular gloves, a measurement device, sterile Q-tips, an extra abdominal pad, and my dressing change tray. So I would start out by getting my supplies, going into the room, checking patient identifiers, asking the patient their name and date of birth, verifying that with the wristband and with the MAR. I would then I'd start out by introducing myself, providing for patient privacy, making sure the bed is at a comfortable height for me to work with. This is a little bit too high for me, but I'm working with what I got. Ask the patient if he has any pain, if he is experiencing pain. I would request and give pain medication as ordered 30 to 60 minutes before the procedure. If there is no pain, I would continue. If this was a surgical incision, I would maintain the same sterile field that I'm doing in here, hopefully, maybe even better. But I would remove the dressing by pulling the tape and dressing in towards the wound, careful not to touch it, with regular gloves. And then I would measure the wound, check for any signs of infection or exudate. And then I would use antiseptic swabs to clean the wound from the area most contaminated to least contaminated. And then I would use one swab for each part of the incision. So I would go down the middle of the incision first, throw away that swab in my biohazard bag, and then I would clean the side furthest from me, dispose of that swab, clean the side closest to me, dispose of that swab, and then I would replace the dressing with a clean one. And then date and time my dressing. But since we're doing wet to dry, I'm going to go ahead and start with that. So I would start by performing hand hygiene. I would put on clean gloves. Making sure my patient is comfortable and covered as much as I can, but still having access to the wound. I would start by removing the old dressing, which I would start by pulling at the corners of the tape and drawing in towards the dressing, or towards the wound, careful not to touch it. So we're going to pretend this is the old dressing. Careful not to touch the wound. I would dispose of that in my handy dandy biohazard bag here. I would then remove all the old packing. I would use tweezers rather than my fingers for this. So remove all old packing, making sure that I get it all. Hopefully I wouldn't have to reach in like this with my bare hands. That's tissue that we're gonna go ahead and let my patient keep. I feel like I'm forgetting something already. Okay, so I removed the packing. Okay, I would then measure. I would measure the wound and make note of that in the chart, making sure I get width and lengthwise. I would get all the measurements. And then I would get a sterile Q-tip. Get a sterile Q-tip and I would measure the depth. And make note of that for the chart. I would also be assessing, while I'm doing this, I would be assessing for any signs of infection, any excess exudate. If I expected excess exudate, I would put a basin underneath the wound to catch it. Measure. And then I would now dispose of this in my biohazard bag along with the Q-tip that I used. And then I would doff my exam gloves, perform hand hygiene, and then I would start setting up my sterile field. Sorry, I don't want it to turn off the video if my computer decides to go down. So I would have another sterile Q-tip, another abdominal pad, my sterile dressing tray. So I'm going to go ahead and get this set up here. I'm going to set this over here. This would not be open, it would be sterile. Okay. I would put on another pair of clean exam gloves for this, but I don't have any more. So I would open my dressing tray. I would remove my sterile gloves and my sterile field pad, making sure to be careful to only touch the edges. I'm not working with a whole lot of room here. No, because I don't want to reach over it. Yeah, I'm just going to set this right here because I'm going to be working from this mostly anyway. Then I would get my sterile gloves. So the fingers of my glove, I realized as I was putting them on, touched my other hand. So I would have to get a new pair of sterile gloves and start this over again. But since I only have the one pair, I'm going to pretend that I did that and not let the fingers of my glove touch my hand. I'm going to dispose of that. Then I'm going to take my sterile saline, which is in my sterile kit, so it is sterile. I'm going to open that and then remove the top. And then I'm going to remove my dressing sticker and my tape. And I'm going to pour my sterile water over my gauze and over one of my abdominal pads. I'm going to close that back up. I am then, of course my nose is itching now. Dang it. I would have opened this before I got sterile because the outside of the package wouldn't be sterile. And if I would have done it this way, I would have had to get another pair of sterile gloves. I would have taken this out before I got sterile, put it in my sterile tray, and then I could begin packing my wound. Please don't. I would not touch my computer with sterile hands, but I'm afraid of it turning off. Okay. I would take my sterile dressings, which are moist. I would make sure that they're not dripping. I would fluff them, and then I would place them on the wound and use my Q-tip to pack it into the wound. being very, very gentle, but making sure that it gets all the exposed areas. And I would continue doing this until the packing is flush with the skin around the wound. I would irrigate the wound first until it runs clear with sterile saline, making sure I start from top to bottom. I can't itch. Making sure I start from top to bottom, and I would use dry sterile gauze to pat dry the skin on the outside. And then after the irrigation ran clear, I would use dry gauze to pat any excess fluid from the wound before I pack it. I would have done all of that before I started this. Otherwise, I would have had to start all over, because that defeats the whole purpose of a wet to dry dressing change if you don't irrigate. This went so much smoother last time. Okay. And I would not use the same gauze to pat dry more than once. Get in there. I would be much more gentle with a regular patient, because hopefully my patient wouldn't run from me the way this tissue box is. There we go. Making sure you get in all the little nooks and crannies, and any tunneling. Okay, now I would have irrigated before, packed the dressing. Okay. I would then dispose of this in my biohazard, and then I would get my moist abdominal pad. That almost touched my non-sterile field. And I would place that, wait, blue stripe goes away from the patient. I would have had to get a new sterile abdominal pad. And I would place that there. And then I would get my dry abdominal pad. That's not unfolded all the way. Okay, and then I would get my tape. And I would window tape around the wound very carefully. I'm sorry, Mr. Tissue Box. Ow. And when I'm done window taping, I will fill out my dressing change thing, making sure to date, time, and I would initial. Oh, it has a thing for an initial here. That way the next nurse would be able to know when the dressing was changed. If for any reason my documentation isn't correct, because tape sticks really good. Oh. I would ensure that the tape is secure, that there are no holes around the edges, that it is as smooth as I can get it. I would reassess my patient for any pain, any discomfort. Make sure this is filled out and apply it to my wet to dry dressing. I would then clean up my area, putting all of this in the biohazard. Including my chucks. And my gloves. I would make sure that my patient's bed is lowered to the lowest position, handrails are up, cowbell isn't within reach. I would provide any education. I'll provide any education needed on caring for the wound, how often to change the dressing. If they have any questions, they can call me. Make sure my patient is comfortable, feeling safe. And I would end my skill and leave the room and go and document all the measurements that I had, any signs of infection or exudate, and any other abnormalities that I would have seen, any extra redness, any swelling, heat, discomfort, and then I would be done. Thank you.